lot of people do not know what kratom is. And honestly, if I didn't work with the DEA, if I didn't know people in the business, I wouldn't know what it is either. But believe me, our patients know what this is. I will tell you that this is the kind of stuff you're going to find at a gas station. You don't even know this stuff, but your kids do. Your kids know all about it. Completely not illegal to sell, by the way, because kratom's not illegal. But this is an opioid your patient may be under the influence with, and you'd have no idea.
The dental assistant and so many other people in the practice are responsible for protecting the dentist's license.
Why this is so important is because if you don't ask, and you're under the influence of these things, and then you do prescribe an opioid for pain, or you do use something for conscious sedation like a benzodiazepine or even, propofol, and they fall into sedation deeper than you want them to, and their airway becomes compromised or starts becoming a medical emergency, someone down the line is going to ask you that question. Well, did you ask him? Because you can bet your patient's going to say, well, I was under the influence of this drug I used right before I walked in. Well, did anybody ask you? No. And that's how bad things happen to good people.
Dental assistants are often the key to a patient accepting treatment or not. You're a key part of the patient journey, and so is CareCredit, a health and wellness credit card with flexible financing options so patients can pay over time for care they want or need, subject to credit approval. Want to know how to make sure CareCredit is a part of your practice's offerings? Email me at kevin@kevinspeaksdental.com and I'll make sure to help. That's kevin@kevinspeaksdental.com to make sure CareCredit is a part of your practice's offerings. Hey everybody, welcome back into another edition of the Dental Assistant Nation podcast. My name is Kevin Henry, founder of Dental Assistant Nation. So glad you joined us and thankful to CareCredit for their sponsorship of this podcast, and thankful to Tom Viola for coming back and joining us yet again. Tom, I'm excited, man. I'm glad to have you back.
Same here, buddy. It's always a pleasure working with you. We got so much to talk about. There's never enough time. There's just not enough time to talk about everything.
No, and last time, we're going to make sure to put it in the show notes, Tom was on, which wasn't that long ago, thank goodness. We talked about marijuana, your dental patients, what that means whenever they come into the practice, and what you dental assistants need to know about that. Today, Tom, we're going to level it up a little bit. We're going to talk about some other drugs that are out there that dental patients may well be taking, and the impact that that's going to have on the dental practice and the dental assistants that may be seeing them. So what's a big one that you want to start off with? I mean, let's hit us in the jaw with this one today. How about that?
I want to talk about novel opioids.
Okay.
And the word novel here is really designed to differentiate these things from other opioids you and I have talked about before, fentanyl, heroin, and so on. I will tell you that this is the kind of stuff you're going to find at a gas station in a certain part of town, or in a paraphernalia shop, or a place where you might find that kind of stuff. Now, I don't want to paint with the broad brush. I don't want to say every gas station sells this or every paraphernalia store sells this. I'm saying if you know your town, you know where to go where you would find this stuff, okay? And we'll leave it at that, all right?
Yeah. But, your dental patients know where to go to get the stuff as well. So tell me, what is the impact of this versus, a marijuana or something that we talked about that maybe isn't as harmful? I don't know if that's the right terminology, but I'm really curious.
All right, so the reason why I bring this up is because people are starting to get kind of nervous with heroin and fentanyl. The reason for that is because there's so many different additives now to heroin and fentanyl. In a marketplace where everybody's basically selling the same thing, you want your product to stand out from all the other products. Well, how do you do that if you're selling heroin and fentanyl, which is widely available just about everywhere? You add stuff to it to make it more attractive so that person will only want to buy it from you. And that's fine for that corner of the marketplace. But the other part of the marketplace is I'm not even wanting to sell heroin and fentanyl. I want to sell things like tianeptine. If you've never heard what tianeptine is and you have no idea what it is, in New Jersey for the longest time, it was known as gas station heroin.
Wow.
Because you can go to the gas station and buy a bottle of this. I'm not allowed to say the name because of a letter I received.
Okay.
I'll leave it at that.
Okay.
But you can find a bottle of this stuff just about anywhere. And it was sold as a mood enhancer, mood stabilizer, whatever. And you'd buy a bottle of stuff and you'd swig it. And tianeptine in large doses has an opioid like effect.
Okay.
Why is that important? Because you're getting the opioid effect without the ding on your urinalysis if you get sent for a routine
Ah,
urinalysis. Doesn't
all
show
right.
as an opioid, right? It's an antidepressant, but it's not an opioid. No, that's even if the urinalysis picks it up because tianeptine is not sold in this country as a prescription drug, right? It comes from Europe. Then you've got nitazines, iso and proto, and those are synthetic opioids developed in the 60s in Europe that were never marketed, never sold because they were highly addictive. The abuse potential outweighed the therapeutic use. Well, you know what that means. Didn't take long for it to come to the United States
For sure.
with that kind of billing, right? So now you can find ISO and Proto. And this is what I try to tell all of the people who listen to this great podcast, my friend. If they're parents, if they're grandparents, the bottom line is what? You don't even know this stuff, but your kids
Yeah.
do. Your kids know all about it. Okay. So ISO and Proto are nitazines. They are these potent opioids. But again, you get this ISO or Proto, you use it, you get all of the effects you're looking for. Bottom line is, if you went for a urine test, it's probably not even going to show up. Why? They're not testing for it because it shouldn't be here in the first place.
And we talked last time, and again, we'll link it in the show notes about marijuana usage and maybe how some people that come into your practice are nervous about even talking about that. I can't imagine they're going to be open whenever you say, are you taking any kind of drugs or anything else in the health history form that they're going to open up about this.
100%, my friend. And I will tell you, that leads us to another discussion because the convergence of these two topics has to do with kratom. A lot of people do not know what kratom is. And honestly, if I didn't work with the DEA, if I didn't know people in the business, I wouldn't know what it is either. But believe me, our patients know what this is. So, what is it? So, kratom is a rainforest tree, grows in Southeast Asia. It produces leaves on this tree that contain alkaloids that have opioid and stimulant like effects. So the active ingredient is mitragynine. Now, I'm not going to lie to you, it's not the best tasting stuff in the world, right? You peel off the leaf, you grind it, you roll it up, you smoke it, you eat it. You get the effect, but it's pretty awful. But
Okay.
again, if you're on an opioid and your doctor cuts you off and says, look, I can't prescribe opioids for you anymore. You really need to go into a treatment plan. What are you going to do in that situation?
Right.
So you might grow your own. Now, the thing is, the reason why this works in that phase of your life is because it's both an opioid and a stimulant. So you don't look like under the influence of an opioid because you look fine. You don't look like you're drowsy or you're nodding off. Okay, so what happens now? Chemistry, my friend, right? So mitragynine is metabolized in our liver to 7-hydromitragynine, and 7-hydroxymitragynine, 7-hydromitragynine, works better than the mitragynine itself. So what do you think? We just synthesized the 7-hydroxymitragynine or 7-hydromitragynine, which are sold on the streets as 7-hydro tablets.
Wow.
I live in the middle of nowhere in New Jersey. I mean, my two neighbors are cows and corn. I am nowhere popular. And I'm seeing, when I walk out to like the main road, I'm seeing little packages of 7-hydro tablets. So if that's here,
Wow.
it's everywhere. And so that's another example of an opioid that, to your point, you may not disclose because, you don't want to say it or you don't think you need to say it. And what ends up happening now is kratom becomes so popular, it ends up in, and I'm not allowed to say the name of the product because of a letter I received. All I tell you is that it's in the little blue bottle at the gas station. So if you go to
Okay.
the gas station in that part of town and you see these little blue bottles, you're going to see what? These little bottles that contain kratom and kava, which is a stimulant. Completely not illegal to sell, by the way, because kratom's not illegal.
Huh.
But this is an opioid your patient may be under the influence with, and you'd have no idea.
So if a patient walks in and they've been using this, are there any telltale signs for the dental assistant or the dental practice to know that this is going on?
So it's always a matter of knowing your patient and not looking at them as just the next patient on the schedule, but actually having a relationship with them, knowing their background, knowing what they're like. Pupil size does help, but it's not always like in the case of kratom because it's an opioid and a stimulant at the same time. Pupil size can be nominal, it could be normal. So you don't always know, but that's why you've got to gain your patient's confidence. And you've got to have that, I call it the standoff, sort of conversation, but it's not confrontational. It's not judgmental. It's basically just like, look, I need to know everything you're doing. Okay. I'm not the police. I'm not the DEA. I need to know everything you're doing because whatever you're doing could affect whatever drug I'm going to be using today to help treat you. And that may lead you harm. And I don't want to lead you to any harm. So you're going to just have to tell me everything and just sit there. Just leave the dead air. Just give them that space to talk. And that's how you'll find out. Now, the most important part about that is whatever they say, if it's yes or no, gets documented, right? Patient admits to the use of, patient denies the use of, and that way it's recorded for posterity.
And if a patient admits to it and you document it, I just wanted to ask you a real dumb question. That doesn't mean like that you're indicting them on anything. As you said, you're not the cops, you're not the DEA or anything else. You're just making sure that your bases and, for lack of a better term, your rear is covered whenever that patient sits in that chair.
I'm going to tell you, Kevin, you're 100% right because some clinicians come to me and say, listen, I don't want to know. Because if I know, then I may have to do something about it. But if I
Yeah.
don't know, then I don't know. It's not my fault. It's not my. But see, that doesn't hold up, unfortunately. And during litigation, you're going to get a question that's going to be, well, did you have any suspicions? Did you ask? Saying, well, I didn't ask is not a defense, right? I don't want to know. So therefore, I didn't ask. You have to ask and then document the answer. Now, again, if you know if the patient's, well, yeah, I do ISO, proto, I grow my own kratom, then you've got to adjust the treatment plan accordingly. Why this is so important is because if you don't ask and are under the influence of these things, and then you do prescribe an opioid for pain, or you do use something for conscious sedation like a benzodiazepine or even, propofol, and they fall into sedation deeper than you want them to, and their airway becomes compromised or starts becoming a medical emergency, someone down the line is going to ask you that question. Well, did you ask them? Because you can bet your patient's going to say, well, I was under the influence of this drug I used right before I walked in. Well, did anybody ask you? No. And that's how bad things happen to good people.
And we talk about medical emergencies that could happen in the practice, everything else. And one point to emphasize here that the dental assistant and so many other people in the practice are responsible for protecting the dentist license. I mean, it's that simple, as well as protecting yourself. And so to ask these questions, I don't care comfort level, anything else, it's a necessary thing that you have to do.
And Kim, you and I have talked about this. The dental assistant is the front door and the back door to any office, right? They're the first person you see when you walk in, they're the last person you see when you walk out. And there's a comfort level with a dental assistant that doesn't always extend to the hygienist or the dentist. Because to me, as a layperson, they're more, on my level than, let's say, someone who's a dentist or a hygienist because they're just good people. I can have a good conversation with this person. And so I might tell you, the dental assistant, things I wouldn't tell the dentist, but that doesn't
Yeah.
absolve the assistant from not telling the dentist when it's something, again, to protect the dentist license and to protect the patient's health.
And if you're the dental assistant, Tom, just a real simple question. Obviously, you've gained that trust, but still, the patient has to know that that's going to be documented. And ultimately, there are other people in the practice that are going to see it. I mean, I think it's okay to be an open book about that should the patient ask, obviously.
100%. You're documenting and you're putting in the chart. And I'm going to tell you that the downside of this is not necessarily a bad side. And that is what that is. All right, I'm going to go there later. She's going to ask me if I used something. So you know what? I'm just not going to use anything today. That way I can answer her truthfully or answer him truthfully and say, no, I didn't use anything today. And that way, honestly, you end up getting the result you want, right? They're not using anything because didn't want to have to tell you they were using anything. So in a way, it's a win-win. And that's how I look at it too. They expect the question, therefore they want to avoid the question by simply not using, and everybody wins that way because it's safer.
And I'm sure there are some dental assistants who are listening to this and going, that doesn't happen in my practice. My patients don't do that. And I'm going to make a bet they would be surprised if they really knew the truth behind those eyes that the patients have.
Kevin, let me tell you, the thing that I've learned as a speaker is the stuff that I would never have thought is the stuff that ends up coming to me. People come up to me after my lectures, especially on this topic, and they will share with me, not only was it like a sibling or a daughter or a son, sometimes it's themselves and they'll confide in me and say, hey, look, I don't tell anybody this, but since you seem to know this stuff, here's where I am. What do you think I should do? And trust me, Kevin, honestly, looking at them, even having a mild, easy conversation with them, I'd probably never know
Sure.
unless they told me. So again, to your point, you don't think it can happen, but it can.
Well, let's emphasize, let's ask, let's document, let's make sure that we're leaving that space, as you say, for the patient to actually answer the question and not interrupting them as well.
Yep. And look, if you're so inclined to go to the gas station in that part of town and take a look around, it's not a bad idea to familiarize yourself with this stuff. Because if I tell you I'm on, let's say, ISO, Proto, or the blue bottle, and you say to me, "Oh yeah, I know what that stuff is. I've seen it." That's a level of communication now that wouldn't have existed otherwise.
Good
And now
point.
I feel more comfortable telling you that kind of stuff because I know you know, and like that just makes you a better clinician overall.
Well, this is why we bring Tom Viola on, because he is the expert whenever it comes to what's really going on out there and what could really be happening with your patients. And Tom, you've got such a treasure trove of information. And I want to make sure our listeners know, how do they learn more from you? How do they pick your brain and make sure they're really ready for the real world whenever it walks into their practice?
Yeah, so please have anybody contact me. Feel free. It's tom@tomviola.com. My website is tomviola.com. I'm going to be launching a podcast soon of my own. And when that's all right, I'll be able to share the news. But for now, on social media, you can find me everywhere at Thomas Viola RPH. So please pop in and say hi and drop me a question. I'll be happy to answer it.
And again, all that show notes really easy to find, as well as the link to the last episode where Tom and I talked about the cannabis usage and practice. Some really great tips in there that I want to make sure that you know before you start work the next day. Tom, as always, man, I appreciate you because I know you got the best interests of not only those dental patients, but the dental practice at heart as well.
Kevin, you promised to be the first person on my podcast, first guest.
I would be honored. I would be honored, man. Say
All
when.
right. I'll hold you to it, buddy.
Sounds good to me.
I appreciate
Well,
you.
hey, thanks to all of you. And
Thanks,
thanks to
everybody.
Tom Viola for being a part of this podcast. We know your time is valuable, and that's why we bring experts like Tom in to let you know what you may walk into tomorrow at your practice. It's an important thing to know, and it's a real world thing that may, who knows, it may save a life. Until next time, it's Kevin Henry, editor in chief for Dr. Bicuspid and the founder of Dental Assistant Nation, signing off. And as always, wish you nothing but success ahead.